Hello everyone. So we've all been spending a certain amount of time over the last few weeks trying to figure out when is the peak of the coronavirus epidemic going to come and what could some of the numbers possibly be when it does actually peak. But today, Delhi Deputy Chief Minister Manish Sisodia came out and dropped a bit of a bombshell on everyone by coming out with some actual numbers. He said that by the end of July, remember that's only about 50 days away, by the end of July, Delhi could have more than 5.5 lakh cases, and Delhi could require 80,000 hospital beds at that particular point. Now, it is possible that Sisodia was also saying all of this because of the row that the Delhi government's been having with the Lieutenant Governor and the entire question of whether Delhi hospital beds should be opened up to people from outside the city and not. But 5.5 lakh cases in Delhi by the end of July. We need to think through those numbers a little bit, because at that level, that's more than any country in the world right now other than the United States and Brazil. And this is just in the city of Delhi 50 days from now. So it's a bit of a scary number. What does it take to get to those numbers? So I've been playing around with some numbers, especially on Parakkar's forecasting tool. And this is really the way you get to those numbers, assuming Delhi continues to grow at the same rate that it has for the last 6-7 days. There's no correction, no flattening of the curve at all, and Delhi keeps growing at that 5.5% or thereabouts. That's when you get to a figure of 5.5 lakh cases by the end of July. And 80,000 hospital beds, yes, that's probably the number you'll have. You may well have something like 20,000 people or thereabouts will be requiring ICU beds if those numbers are correct. Now, by the way, if you take those same sort of assumptions that there's no flattening of the curve and you project forward 50 days, end of July, using the sort of numbers that we are seeing right now and forecasting it without much of a flattening of the curve. By the way, India itself gets to a number of something like 3 million cases by the end of July. So yes, those sort of forecasts are scary. Let's see if that's what's going to happen. Let's see if it's going to slow down a little bit. Who knows, seeing as we've unlocked completely and everyone's walking around everywhere, there may even be an acceleration. But the basic point to note though is that whatever the actual number is, we'll have to wait and see. But if the Delhi government believes, Mr. Sisodia believes, and if others believe that this is potentially what could happen, we have to really move into getting medical and supplies and getting healthcare sorted out on an emergency basis. 80,000 hospital beds aren't going to be easy to set up. You're going to have to take over sports stadiums, Indira Gandhi Stadium, City Fort, maybe even Jawaharlal Nehru Stadium, who knows, put a roof over it, find ways of taking over hotels. 80,000 hospital beds, it's going to be a struggle to get there. 20,000 ICU beds, it's going to be an even bigger struggle to get there. So those are the numbers that we think we could get to in cities like Delhi. We've got to start preparing on an emergency footing right now. And let's hope that it doesn't really come to pass. But it's better to be prepared, I guess. Now a quick look at all the big stories.
There is no community spread of coronavirus in Delhi, according to central officials, Deputy Chief Minister Manish Sisodia said after a high-level meeting on Tuesday in the capital. The Delhi Disaster Management Authority had met to take stock of the COVID situation in the capital amid a sharp spike in the number of cases. Delhi Health Minister Satyendra Jain had said just before the meeting that half the coronavirus cases in Delhi cannot be traced to any source, leading to fears of community spread. In a grim estimation of the COVID outbreak in the capital, Deputy Chief Minister Manish Sisodia on Tuesday said that Delhi is likely to see 5.5 lakh coronavirus cases by July 31st. Defending his government's decision to reserve beds in Delhi state hospitals for people from the capital, Sisodia said that the city will need 80,000 beds to cater to 5.5 lakh cases, and that's why the government took this decision. But the Lieutenant Governor of Delhi has overruled the Kejriwal government's decision.
31 जुलाई तक करीब 5.5 लाख केस पहुंच जाएंगे दिल्ली में और उसके लिए करीब 80,000 बेड्स की आवश्यकता होगी।
India on Tuesday reported another surge of close to 10,000 in the number of coronavirus cases. The country recorded 9,987 cases in the last 24 hours, which took the overall tally to 266,598, according to the Union Health Ministry. The number of active cases in the country is 1,29,917, while 1,29,214 have been cured or discharged, the Health Ministry update at 8 a.m. showed. The number of those killed by the disease reached 7,466 on Tuesday after 266 fatalities were reported in the last 24 hours.
The central government has issued fresh guidelines for its officials and staffers after increasing number of COVID-19 cases in its various ministries and departments. Only asymptomatic staff have been asked to come to offices, and all those with mild cold, cough or fever have been told to stay home. The government further said that the staff members living in containment zones must work from home. The circular added that not more than 20 officers and staff members should attend office in a day, and those sharing cabin should come on alternate days. Masks are a must for everyone, and face-to-face meetings should be avoided.
The Supreme Court has read the Riot Act to the central and state governments on the issue of migrants. The top court on Tuesday ordered that migrant workers should be transported back to their hometowns within 15 days. The court has also ordered that all cases registered against migrants who have allegedly violated lockdown orders should be considered for withdrawal. The court directed the centre and states to prepare a list for identification of migrant workers in a streamlined manner. The court added that in the event of demand of Shramik trains, railways shall provide trains within 24 hours.
The findings of the first of its kind population-based sero-survey conducted by the Indian Council of Medical Research to evaluate the extent of exposure to COVID-19 shows that nearly 30% of the population in several containment areas may have contracted the disease and then recovered. ICMR, along with state governments, the National Centre for Disease Control and India's Office of World Health Organization tested close to 24,000 samples from 70 districts across India from randomly chosen individuals. The findings of the report also reveal that in Mumbai, Pune, Delhi, Ahmedabad and Indore, the infection rate is much higher than other containment areas. The findings of the sero-survey do not imply the presence of herd immunity, but it shows that immunity to the infection is developing gradually in India.
BJP leader Jyotiraditya Scindia and his mother Madhavi Raje Scindia have been admitted to Max Super Speciality Hospital in Saket after they complained of throat irritation and also had fever, both COVID-like symptoms. A PTI report quoting sources now says the BJP leader has tested positive for the infection. It is not clear, however, if his mother has also tested positive. They were both admitted to the hospital on Monday. These reports come just days ahead of the Rajya Sabha by-polls in Madhya Pradesh, for which Scindia is in the fray. Worli and Dharavi, which emerged as the two major COVID-19 hotspots of the city in the beginning of the outbreak, are now witnessing a decline in the number of average daily cases, the Hindustan Times has reported. Worli reported an average of 60 cases a day in May, which has come down to 35 to 40 in June. In Dharavi, the average new cases have come down from 47 in May to 27 in June. The doubling rate of Dharavi has gone up to 44 days, while it takes 30 days for cases to double in Worli. The two areas have also reported a recovery rate of 50%.
Indians are getting more anxious and worried about the COVID-19 situation in the country amid a surge in the number of cases, according to a new survey. While 21% felt anxious about the situation during Lockdown 1.0, the survey by citizen engagement platform Local Circle said the number has risen to 56% now with the government's announcement of Unlock 1.0. The survey also said the need of the hour is for the government to evaluate if Unlock 1.0 makes sense for every district, or the high virus load cities like Delhi, Mumbai, Chennai, Ahmedabad, etc. must be treated differently. To the question on how they felt about opening up of most activities, the survey said 27% were of the view that it will likely lead to a significant rise in cases and complete lockdown should have been implemented in high virus load districts, while 52% said it will likely lead to major increase in cases, but we as a nation do not have the option of staying locked anymore.